Dr. Celine Gounder now, epidemiologist and professor at New York University. Dr. Thanks. President Biden is betting big on this antiviral pill, but how much of an impact is this going to have in the short term?
Kelly, I don't think we're going to see a huge impact of the Paxlovid Pfizer drug for the coming months. And that's for two reasons. One, we're going to have limited supply of Paxlovid in the first 6 months or so of this year. And secondly, you really need a system of rapid, free testing available to the American population so they can get a test result and then get prescribed these medications as quickly as possible. These medications need to be given within 3 to 5 days of symptom onset. So we really need to have that foundation of testing for drugs like Paxlovid to truly be game changers.
There's a debate over whether to focus on total case numbers or hospitalizations. The problem is the former tend to be a lead indicator of the latter, and hospitalizations are approaching the peak that we saw last January. They may not be as serious, though. What can you tell us about the severity of this disease?
Well, we are certainly seeing a decoupling between cases and hospitalizations. So this does seem to be a milder disease where fewer people are ending up in the hospital with Omicron. That likely is because it's an upper airway predominant disease as opposed to the earlier variants, which really were attracted to the lungs and other internal organs, causing more severe disease. But that said, even if it's a milder infection, if you have so many people being infected across the country, let's say it's half as deadly. If you have twice as many cases, that still gives you the same number of deaths. And we are indeed seeing a surge in hospitalizations at this time.
Yeah, and those essential workers are overwhelmed. I mean, we're going on the second year of being on the front lines. Florida Surgeon General yesterday suggested that testing should be prioritized for high-risk Americans over younger people. Do you agree with that approach? But I think more importantly, every passing day, we see more and more testing requirements for kids in schools, which flies in the face of that.
I think it really comes down to what are your goals. If you are trying to prevent all transmission, all infections, the vaccines alone will not do that. And that's because, especially with Omicron, with such a short incubation period, that makes it very difficult for the vaccines to prevent all infections. If you want to prevent more infections than you can just through vaccination, it does mean you have to use other tools. And those other tools include masking, indoor air filtration and ventilation, and then, of course, rapid testing to identify who might be contagious or infectious to others.
Yeah, it's in much the same toolkit we've been aware of for the last couple of years, and yet so many still lack those necessary tools. Dr. Gounder, thank you for your time tonight.